The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, LA. Welcome to another Ask the Experts. Our first guest is very special, and the reason why is we have received so many emails from all of you asking us to please add a show, an expert on dental implants. Well, it's not that easy to do. And also, a lot of people want to know about cosmetic dentistry. So we have been working on this for about over a month, and we were able to find one of the top dentists in the Los Angeles area, and we're so glad to have him. We're going to be talking about dental implants, which just happens to be one of our hottest topics in our other markets. So I'm so glad that we have Dr. Shernan with us today. And our second guest is world-renowned, our weight loss doctor, our MD, our weight loss, Dr. Gupta, will be coming on right after this. We'll be talking about weight loss. But let's get started. Good afternoon, David.
Good afternoon, Steve-O. Pleasure.
Good to see you, bro. I got to tell you, we have had so many people ask us, get us somebody who understands dental implants, because there's so many things that people do not understand about dental implants.
Yeah.
And so before we get started, tell people about yourself and your practice.
Definitely. So my name is Dr. David Sherinian. I'm a USC grad, right on. And our practice is over at Pasadena. And it's called Signature Smiles Dental Group.
You know, how long have you been in practice for, David?
So I've been in practice for about 4 years now. But we actually opened up our office in Pasadena last year. So we're running our office here. We have a general dental practice. We see all kinds of patients from A to Z. Everything is in-house with the top-notch, high-end technology that's very important for modern dentistry nowadays. But we try to focus our practice over for cosmetic dentistry, such as veneers, or even just tooth replacements, implants, and full mouth rehab as well.
Well, there are a lot of people, David, that would really like to get implants, but there's so much they don't know, and they're afraid to ask even. And I got to tell you, what we're finding out across the country on all of our shows is people will travel a long way to go to the best. And even though you're in Pasadena, I am telling you, you want to go see Dr. David, because Dr. David is... He's at the top of his game, and you're going to see today we got so many questions for him that it doesn't matter where he's located at. Now, what do you, on the first visit, do you Zoom, or how do you work the first visit?
So, I mean, we have Zoom or anything available for our, out-of-state patients that want to meet me and consult with me before they make the trip out. But for the local patients in LA, we have a free consultation. They come in, we get a panel or a CT scan right in the office, and we meet with the patient, go over their health history, go over their kind of their dental history and their story of what's going on. Because most of the patients that come in for interest in implants, they have some kind of background. Something's going on with their mouth that's obviously not healthy, or they're losing teeth, or they need to remove teeth and replace them. So we want to kind of get the background, get to meet the patients, and then we come up with a plan for them that's going to be both comfortable for them and uh, meet their expectations.
I tell you what I hear in other cities that we have a dental implant expert. Cities like Atlanta, Philadelphia, Florida. People who have these implants done, it actually changes their entire life. They
Definitely.
have no confidence at all. They might be just missing a tooth, especially women. They might be missing a tooth, and then they went and got the implants. And David, it changed their entire life.
That's totally accurate. We've had patients, needing a full mouth rehab, whether it's due to function. Some of them miss eating. Some of them miss chewing and tasting the flavor of food, which you can't really obtain with dentures, because you have a plastic piece of prosthetics in your mouth. Imagine having a credit card in your mouth and just chewing with it. You're not going to taste food, right?
Right.
So we changed lives like that. Strength of chewing, more secure, more strength, so they're able to chew food more comfortably. And then, of course, the cosmetic aspect of it. Every night you don't have to take off those dentures and put them away. You get to keep your smile right in your mouth, without having to worry about removing it. And it's both a self-confidence, self-esteem boost. And most of our patients, at that stage, if they need it, are either married or have their significant others and their partners, and they get a big boost confidence in their relationship as well.
Well, we just got our first text. A listener wants to know that I guess they are, I guess, more mature because they're talking about Medicare. Is it really true that Medicare is starting to pay for implants?
As of right now, I don't believe so. So
Okay.
a lot of, implant dentistry is a little higher on the scale in terms of, with insurance companies, they're trying to pay for what is absolutely necessary, and implants is somewhat of an extra luxury for you, because there's different alternatives to the treatment plans and etc. So for the most part, they do not. However, I do see in the near future that they may start to at least approve certain cases, because it's becoming the standard of care now.
Yes.
Before implants, like I was saying, was just a luxury to have, but now it's becoming the standard of care, and the route that we all want to share with our treatment plans for our patients.
So, how long does an implant last?
So implants can last anywhere from 5, 10, 15, 20 years, and even more. There's a lot of factors that plays into it. Obviously, the most important part for an implant to be successful is the osseointegration that it has with your bone, which is basically the fusing and the connection it has with the bone and the implant. Now, there's different techniques and different theories of how to place implants and how to restore implants, which, there's no right or wrong per se. But of course, the longer you wait, the more secure you are and the more safe you are, um, with the implant placement, the more chances of it succeeding. Now, of course, you want to stay healthy. Certain things like diabetes, uncontrolled diabetes, or smoking, or just overall an unhealthy lifestyle or oral hygiene will definitely decrease the lifespan of an implant. just like it would decrease the lifespan of your own natural teeth. So it's just, at the end of the day, the factor is you do need to still take care of it and maintain it, just like you would anything else, like a
You
car
brush them
or your
with a
house.
toothbrush?
You maintain it with brushing just like normal, just to make sure certain foods don't get stuck. But the best tool, especially for full mouth cases, is a water pick, because now you're able to clean underneath the bridge or the snap on denture. Just be able to wash it out, power wash it, and just clean it really well. And of course, you would still want to see your dentist every 6 months to a year, just to maintain it, make sure any additional plaque that's built up is taken care of and removed, um, and just always keep a close connection with it. It's a big commitment, Steve.
There's a lot of
It's a
things with
time
dentures.
commitment.
There's a lot of things with dentures. You have to be careful what you eat. What about implants? Is there anything you can't eat?
So you're pretty flexible in what you're able to eat. However, you don't want to be eating walnuts every day or cracking the walnuts every day, so
Right.
both for like cosmetic purpose and putting pressure on the implants. But they are definitely stronger because it's made of zirconia. The bridge is made of zirconia, and it's connected to the implant, so it has a much more supportive strength to it. So comparing to a denture, you definitely have more range of what foods you can eat, but at the end of the day, you always want to still maintain it and be cautious with it, because it is something foreign in the body. At the end of the day, it's not your own teeth. Whoever ends up having full mouth restoration is because their teeth are not in great condition and needed to be pulled out. So, with the technology and the modern dentistry the way it is, we're able to restore it and bring it back into reality, but you still have to be careful with it.
If you have a friend or a relative that is thinking about having implants and they want to rewatch the show today, they can go to iHeart, their library, and just put in Ask the Experts LA dental implants, and you can pull up today's show. And David's going to be with us each month too. And you can also go to YouTube and look up the show. We're also running at the bottom of the screen David's phone number to call and make an appointment. David, for those who are listening on radio right now, what is the phone number?
626-381-9288.
One of the things that attracted me to David was he has got the most beautiful website. It's
Appreciate
www.signaturesmilespasadena.com. And like I said, David will be with us each month. We've gotten 4 texts already. Thank you for bringing this show on. So that's wonderful. You got to have your cousins stop writing us. Anyway, so I've decided, okay, I think I want implants. What is the first step?
So, Steve, if a patient is coming in with a broken tooth that needs to be extracted or pulled out, the first step is to remove the tooth and place a bone graft. Now, what a bone graft is basically a powder bone, which could be made either synthetically or through a cadaver bone, or even through an animal. It just depends on the source that the doctor uses. And basically, you remove the tooth and you place the bone graft in the socket the same day. Now, the reason for that is to preserve the socket, and allow the bone graft to regenerate with your bone and solidify it. One example is basically after you extract the tooth, you have your socket like this, right? If you don't place a bone graft, over time the socket is just going to collapse. And now
Right.
this is too thin to place an implant. So the idea behind it is to preserve the socket and place the bone to have that width and length, and thickness for the implant to securely get placed in. Now, again, every doctor has a little different methods on how they like to place them and how frequently. But I've realized the most successful route for our office has been to be patient and let everything heal one step at a time and then not to rush things. So after we place a bone graft, we usually wait about 2 to 4 months, depending on the case, depending on the patient's health history and how well the bone is reacting well to the patient's bone. But once we have the bone solidified, then we take a CT scan. And with the CT scan, is it's a three-dimensional radiograph that allows us to see all dimensions of the patient. So we know the height, the width, the length, the angle, if there's any specific nerves around the bone that we should stay away from, sinuses, anything you can think of, we can see in that CT scan. And what we make is a surgical guide. So we have our lab make us a specific custom surgical guide for that patient, for that implant site, to accurately place the implant and remove any guessing game or uncertainty through that guide and the CT scan. So after the 2 months that the bone has been fully solidified, we then prepare for surgery with the CT scan and guide, and then we place this implant right where the socket is. After the implant is placed, again, this is where there's some different theories behind different doctors, but after the implant is placed, I like to wait for about 3 to 4 months for the implant to fully osseointegrate and fuse to the bone. That allows perfect connection to the bone where we have no worry of anything. And that way, if anything does happen, every month when we check the patient in and for a post-op, we make sure the x-rays that are taken, that everything is going as well and healing as properly as needed before we place in a crown where the patient's going to end up spending money, and then if it God forbid fails, now we have to redo the whole thing. So one step at a time is the way to go. You've waited this long. What's a couple extra months, right? But at the end of the day, it gets done properly. Once the implant is healed, we take the impression. In fact, we actually take scans in our office, so no impressions. But once the scan is sent in, we deliver the crown.
How painful is this, David?
There's no pain whatsoever. You're nice and numb during the procedure. We cover you with medications, certain pain meds or whatever's needed for you to have a very fast recovery. I've actually had patients have the surgery in the morning and go to work right after. There's no
Wow.
specific downtime, no recovery time. There's healing time, but there's no recovery time. So obviously it takes time for the area to heal, the bone to heal, the implant to heal, but that doesn't stop you from your day-to-day activities, and it doesn't weaken your system for you to take time to recover.
That's amazing. It sounds like it would be very painful. Now, there are patients you get that have problems where um, I guess the bone has worn away. What do you
Correct.
do for those to build that back up?
So if it's for a full mouth case, where I prefer to place about 6 implants for a full arch bridge, we first have to see how much bone you have, right? And that's where the CT scan comes in. But like you said, there's a lot of patients, especially in the bottom towards the back, after wearing dentures for many years, let's say, they lose a lot of bone. So what do? We can't just remove the nerve or increase bone and just create something that we don't have an area to succeed. So there are procedures called an all-on-4 treatment for the full mouth case. Now, the way all on four works is no different than if it was all on six. The only difference is we use the bone that we have. So if needed, we have angled implants to extend the posterior extension towards the back for us to have a nice arch. Now, in our office, we kind of stick to what we have. So if the patient has perfect bone where we can fit 6 implants, I'm placing 6 implants to make sure we get the most out of their existing condition. But if the patient doesn't, we don't just give up. You know, we try to get the patient what they want, which is a full arch, fixed restoration where they don't have to remove it every night. So we come up with the plan to get the most extension towards the back, and the way to do that is angle it and place the implants at an angle of about 45 degrees, and then place a nice bar. Okay, it's a titanium bar that gets screwed onto the implants, and then the bridge comes and gets nice and cemented onto the bar. Now that bar is amazing. It's such lightweight in your hand when you hold it on, or it's an amazing feature that modern dentistry has um, evolved to. But there's endless opportunities and endless creative ways to restore a patient's smile and get them to smile back, where it's going to succeed as well. Because who cares if it looks great, but if it's not working and it
Yeah,
breaks,
right.
right?
Exactly.
So and that's where that bar comes into play, because now by placing angled implants, we're able to place a nice bar and put all that pressure onto the bar.
We're getting a lot of texts from viewers wanting to know when you're coming back on. David will be back with us next month. We're working on the date for next month. We got 8 people want to know when you're coming back on again. That's a good sign. This is your first show. That's a
Awesome,
really good
thank you.
sign. Uh, we're about to end here, but I want to ask you a question and just be honest with us. Why should I come to your practice?
Um, the non-cliche answer, where everybody is probably practiced, is um, our patients trust us. And when they come into our office, especially for a consultation, they're scared, they're nervous, they're confused because they've gone to multiple different consultations and heard so many different opinions and so many different things, and they feel a little overwhelmed. But at the end of our consultation, the patients feel confident in us, and they feel more relaxed because they feel like we are our best interest is the patient's best interest. Nothing else
Right.
matters. Um, at the end of the day, our goal is to provide customer service. When the patient walks in the door, they got to get that red carpet service from A to Z. But that's something that we do to make them feel comfortable. But at the end of the day, it's the demeanor that we have, and the explanation that we give to the patients, that they understand completely. All we care about is their interest, and for them to get what they want, and at the most comfortable process ever. And when they walk out our door, they feel comfortable, they trust us, and in all honesty, they choose us over all those other consultations because they just feel welcomed at our office.
David, what a great job. This is your first show, and we've got
Appreciate
thousands
it.
of people out there watching and listening. The phone number is 626 381 9288. Is your practice open on Saturdays?
We are open a couple Saturdays a month. As long as it's scheduled in advance, we can get you in, and we're open Monday through Friday as well.
What a great job. David, again, like I said, will be back with us again next month. We will let you know the date. Thank you for all the people who wrote. David, I'm glad our first show went off so well.
Appreciate it. Thank you so much,
We'll
Steve.
talk to you soon.
Glad
Thank
to
you,
be here.
David.
Thank you.
We're going to go to break, and when we come back, we've got our great weight loss show, and we got a special guest with us in the studio. We'll be right back.
K. Bender Rembaum is a full-service community association law firm dedicated to the representation of community associations throughout Florida. On kbrlegal.com, you can learn more about their offices in Pompano Beach, Palm Beach Gardens, Orlando, Tampa, as well as throughout Miami-Dade by appointment. Several K. Bender Rembaum attorneys are board-certified specialists in condominium and plan development law and assist clients with all matters of community association legal issues while keeping them up to date on new developments that affect their associations. K. Bender Rembaum is also a well-known provider of free legal education for managers and board members. Contact K. Bender Rembaum today by calling 800-974-0680. That's 800-974-0680 to reach any of their locations. You can also visit them online at kbrlegal.com or write to them at info@kbrlegal.com.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
And we are back. This is the Ask the Expert show. We have something special for you today. We had one of our experts who could not make it today, and because his shows are always dated, we could not run a rerun. And I was able to get the great Dr. Gupta on with us today. He is our specialist, our expert in weight loss, and I understand he has a guest that he's going to share with us. Good afternoon, Dr. Gupta.
Hey, what's up, Steve? How's it going?
My buddy, my friend. God, we are getting more emails for your show, and we just started the show a couple of months ago in Los Angeles, and now we're in California, and I understand you've got a friend with you.
Yeah, I have my partner, my really good friend, Dr. Amit Mishra. He should be in the backstage, I think. There we go.
Ah, there he is. Hey.
Good afternoon.
So I brag on you all the time because I think it was genius of Dr. Gupta to bring on a specialist in pediatrics. And that's what you do. Because, I mean, there's so many kids that are probably heavier than ever. And it's so easy to understand because they sit around all day. And now is the time to teach them. So by the time they get to an adult, they might not have to see Dr. Gupta. I'm so glad, though, that this is something really special that you both are forming. And I'm so excited that you're part of the show. Dr. Gupta, we have to do this because we're getting so many new people tuning in. Sure. Tell people about your practice, and then I want Dr. Mishra to do the same thing.
Okay, for sure. So our clinic's called Mindful Weight Loss. We started a few years ago, but in the last few months, years, we've been expanding quite a bit to opening up an office in Vegas. We're going to open one in Arizona, but we practice in multiple states. We see a lot of patients over video. And what I describe ourselves as doing is a combination of evidence-based medicine with a comprehensive and holistic approach. So, this whole world is kind of blown up. There's a lot of people in this market right now. I would argue what we do is really offer a much more, again, this comprehensive approach that deals with everything in people's lives and the root causes of why we all struggle with this issue. And so we've started, and I'm really excited, Steve, as you've been talking about, to move on towards pediatrics, because I tell you in every show, I struggled with this as a kid as well. It's near and dear to my heart. And, we want to, all of the principles we use for adults, we want to use for kids as well, which is figuring out, instead of like necessarily, use the word teach, right? Or teach them what to do, which is part of it, but it's more like, what is your life like? And how can we work together to help optimize some of the things to get this done?
Dr. Gupta, I got to tell you, we are getting this. I don't know if you'll be surprised at this or not, but we are getting so many letters, people saying, is Dr. Gupta a real doctor? Or is he a DO? Or is he a chiropractor? I mean, and I tell them you're an MD, they seem shocked. Why is that?
I guess there's a lot of, I think it's because, this field has been around for a while, which is obesity medicine, right? But it's gaining more and more prominence because I think a lot of medicine often was nihilistic about it, right? Like you go to every doctor, they say lose weight. And then everyone's like, okay, now what, right? If it was that easy, we'd all lose weight. 70% of us, however, struggle with this issue. So I think in the last few years, more and more people in the medical world are taking this issue seriously. It's not just hopeless, right? There are things we can do to actually help people, help. It was actually interesting. A study came out today that one of these medicines, these new weight loss medications, actually has a 20% reduction in the risk of heart disease and stroke, right? So we have now come out with all these new tools as well, in addition to everything we're doing to actually change people's lives and health.
You know what it is also is when you go to your internal medicine, but normally you go to internal medicine, they say you need to lose weight. You go, okay, what? And they give you things to eat or something.
Yeah, it doesn't work.
What you have developed, you've got a whole bag of arsenal.
Yes.
I mean, maybe this might not work for one person, but this might work for you. And then we come down to Dr. Misra, and don't you have to use different psychology when it comes to kids than you do with adults?
That's interesting you asked that, Steve. Well, one of the great parts about kids that start to struggle with weight, you start to see it more in the teenage years, right? As the body starts to transition into puberty and you start to develop those male or adult type characteristics. What you're able to do is that you have to remember that those children are also starting to, from a mental capacity standpoint, start to actually understand things as adults as well. If you look at the medical literature, for example, patients as early as 8 years of age, as they start to participate in research studies, we actually go through a process known as assent for them, which is where you talk to them about whatever study they may be starting to go or participate in to make sure that they are also on board. Of course, from a legal standpoint, parents are still kind of the decision makers, but we in pediatrics recognize that even as young as 8 years old, there may be the ability for kids to start to grasp on to some of the more complex topics and concepts. And we want to make sure that they're on board with whatever we're doing. So when we come to weight loss, as they start to go through that process of puberty, they start to maybe struggle with this. And, our goal, again, using the pillars that Dr. Gupta has kind of created with his program, is to institute those within our pediatric population and help them understand kind of from a fundamental level up. And as you mentioned at the beginning of this show, if they can set these habits in place at an early age, potentially, when they become older, they're not having to come back at that point.
Well, I'm going to say something maybe I shouldn't be saying, but I'm going to say it anyway. You don't hear of a lot of people, I guess adults, committing suicide because they're overweight. But you do with kids because of peer pressure. How do you treat those kids?
So again, I think one of the pieces that we've kind of established and developed within the program that we've created is to make sure we're looking at the patient holistically and globally. So we don't only address the pieces about weight, but we also look at, as Dr. Gupta mentioned, what their life is like. How are they doing at school? What is their interaction with their friends? How are those social interactions impacting them? Especially nowadays, we have all of the social media that many teenagers are getting on, and it becomes not just a very, localized potential bullying, they can be bullied from across the country or across the world. So we want to make sure that as we recognize how these kids' lives are, how do we help them not only become, a little bit more resilient against that, but also develop self-compassion for themselves so that they can weather through some of these challenges. And hopefully, if we're able to institute our program and they're able to kind of follow along, they start to feel better, not only about their weight, but they start to feel better about themselves as a whole.
Boy, when you go into a supplement store, they don't ask any of those questions at all. That's why, it's what you do. I guess you two are going to really work off of each other, really. I just think this is the perfect marriage, so to say, because this topic, and I'm going to tell you something, I never realized how important weight loss is until it affected me personally. I mean, you can't just say anymore, well, I'm overweight, I'm going to try to do something. What it did, Dr. Gupta, we've talked about this. What this has done is for me personally, the things that go wrong with your health and high blood pressure and sleep apnea, so many things it affects. You can't just say, it's going to go away. It's not going to go away, is it?
Yeah, and I think the important way to deal with this, right? I think unfortunately the majority of time there's so much judgment and shame around that, right? And that leads to why, we're all like autonomous beings. We want like wellness, we want health, right? And too often it's always framed as, oh, why are you doing this? Or why are you doing this? Or how could you let yourself do that? All that's nonsense, right? Like, I think it's really important to actually begin that conversation around, self-compassion and teaching people there are reasons why this is hard. Again, 7 out of 10 humans in the United States struggle with it. It clearly shows this isn't some individual thing, but this is more of, it's a reaction to our food environment in combination to our biology. And I think that's really important, to really start the journey from that place to really come up, with interventions that truly work, that are not just marked by guilt and shame and things that don't work, that is often tried.
People should use a little common sense. It's funny, Dr. Gupta and I had the same problem with the same supplement. I got very sick from it too. You can't walk into a supplement store and they hand you a pill. That's just not how it works. It's a shame it's not that simple.
Yeah.
That's just not how it works.
Yeah.
But what I like at Mindful, what you do is you start with the mind.
Yeah.
Getting them right, whatever that might be. Yeah. You don't just hand them a pill.
Yeah, exactly. And, I think it's so about just listening and really figuring out what someone's life is like, right? You can't really start an intervention, because often like what happens is you like walk in somewhere and someone tells you, oh, these are like the 17 things you have to do after 5 minutes of talking to you, right? So we spend an hour, talking to our patients in our first visit, really getting to know everything in their lives, right? Like everything about their jobs, their work, their partner, their history, all the medication, all the supplements, all of it, right? We want to know everything because that's the only way you can actually come up with something that truly works in someone's life.
What do you do when you get a patient that said, I hate to work out. I hate what a word you don't like using is diet. What do you do for them?
Well, we don't actually stress physical activity at the very beginning, right? We see where they are, right? That's kind of the most important thing. And we don't use the word diet. And actually, I told a patient this today, it doesn't work if it's hard, right? This is more about figuring out interventions that make it easy, right? So the patient, like a patient today that I had, we were talking about, she comes home from work and between like 6 and 7, she eats something before making dinner, right? So
Right.
it isn't about just like coming home and trying as hard as we can not to eat. Instead, we explored, maybe let's drink the protein shake we were drinking, but let's drink it at 5 p.m. so that you're less hungry. When you come home, let's sit for it took her half an hour to cook dinner, so let's sit for 15 minutes. Because the reason, she wants to munch on something, often she has a hard day, she comes home, she's already going into cooking mode, she's starting that, more stress. We want to escape from suffering by eating the chips or the gummies, right? So we brainstormed, let's go home and sit and do nothing, right? For 15, 20 minutes, not even meditate, just do anything, right? Just relax, go on your phone, do whatever you need. Then let's also rearrange your pantry, right? To make it not there, right? Make the food not there. So all of these interventions that we did were not about making it harder or more difficult. It was all about in the moment making it easy, right? It's not like the bag of chips is there calling your name because the bag of chips isn't there, right?
That's right. Dr. Bizer, are you treating the child or the parent?
So that's a really interesting thing. Yeah, that's a really good question, Steve. So again, a lot of times what we've seen with our pediatric patients is that we obviously the kid is being brought in to kind of help and assist, but many times we're actually helping the whole family out. And
Right.
what you find is that as you start making some of these changes for the kids, the parents start to see some of the results, and they start to recognize that, oh, this is something that's working. Maybe I should try it out a little bit and see if that's also helpful in my life.
Are kids lazy when it comes to weight loss? I mean, they come home from school like I used to do. I went outside and played, ran. Now it's sit.
Right. Well, again, I think we live in a world where we're a lot more connected. But what that does to us, it also makes us a little bit fearful. So, there used to be the ability for you to let your kid out and run around on the street and have a good time. But we've now started to not do that because we're afraid that there may be something that occurs on the street. They may get injured. Something may happen to them. And a lot of parents have pulled back. Well, when it comes to safety, I recognize that that's not something that everyone has access to. But there are other things that we can do just even within the house. Playing or making a game out of simple chores even is somehow it increases that physical activity that may not be there if you're just sitting on the TV watching TV, sitting on the couch watching TV or sitting in front of a TV playing video games. But we can also implement good habits by, again, a mindset change that, again, maybe chores may seem hard, but at the end of it, there's a good outcome that comes from it. And as we start to implement some of those small changes, physical activity increases. And as we talk about how to make better choices on snacks and et cetera, you start to see the effects globally for a patient that come through.
Yeah, and I think that, just like the food companies, the social media companies are they're masters of getting the kids and all of us looking at our phones into our devices, right? So it's really starting where, again, the same thing over and over, starting where, the kids are, the parents are, right? They seek, even though it may not seem like it, right? When someone's looking externally, they seek to be healthy and thrive and, have a different relationship. But there's all these external factors, right? So it's not about necessarily changing everything about someone's life, right? With the kids, you're seeing where they are and asking them, what is a small step you can take, right? That's kind of the main thing, getting their buy-in so that something isn't happening to them and figuring out what in their life, because there's always something, right? There's always something. I had a patient who was younger, who was walking her dog, right? That was a pleasurable thing in her life, right? Versus that. So just adding that, do that one more time during the day, right? Or switching from the soda to sparkling water or something, right? It's just there's many different levers that are available that fall within the realm of what, someone likes, and they just have to be, people just have to be talked to in the right way to bring that out.
Dr. Gupta, you experienced in being an internal medicine doctor, which I'm very well aware my brother-in-law was the head of internal medicine at Baylor Hospital in Dallas. And you usually have a lot of older patients.
Yes.
How is it compared now? What kind of thrills do you get now with dealing with weight loss versus heart attacks?
Yeah, I mean, so I describe this as the most gratifying work I've ever done, right? Because I'm working in the hospital today, actually. And then, you see a lot of the patients that come in that have had decades of disease. But if in people's 30s, 40s, 50s, 60s, you get people, which we have, lost tons of weight, you are increasing their insulin, you're decreasing their insulin resistance, right? You're decreasing the risk of heart attacks and strokes and all of that. That will prevent decades of disease, that heart attack in 20 years, that will affect them, their jobs, their families, their whole community around them, right? So it sounds grandiose, but like treating a person's weight like literally affects like their entire society in multiple different ways, right? Because it's also those 20, 30 years they're living this healthier, more, a healthier life where they can thrive more versus otherwise.
What do you think about, probably just had someone write us, the product Golo? Does that do what it says it's going to do for diabetics?
So I haven't heard of this. I'm always learning new things. So let me research it. I'll get back to you on it.
Yeah, they do a lot of advertising that when you're a diabetic, it's a different type of weight loss. So
I would be, I shouldn't say anything before actually learning about the company, but I would be skeptical. But again, I have to, let me look at it, and then then the next show I'll comment on it.
I got to tell you, this is becoming the most popular show. What used to be personal injury, now it's becoming weight loss. And both of you are going to be playing a very big part in something that I want our listeners and viewers to understand. You might say, God, I wish my wife would have heard today's show. Well, guess what? You can go to iHeart. We are partners with iHeart. You can go right to their library and you can pull up today's show, or you can do it through YouTube. So you can tell people they can go back and listen to the show. Starting next month, Dr. Gupta's with us twice every month, 3 times this month. We're going to start taking your questions, and we're going to present those to Dr. Gupta. And that'll be fun. And we'll be giving out our text number again. It's 954-336-3767. This show goes by so fast. I'm so glad I was able to get you guys on today. For the ones who are listening on radio, give them the phone number, Dr. Gupta.
Sure. It's 310-220-4543. Again, 310-220-4543. Go on mindfulweightloss.com. We're also, for all your guests, all your listeners, we're offering a discount of $100 per month for the first few months. So we're really excited about this offer. And just about our pediatric program, we can see patients right now in Nevada and Arizona. So I just wanted to throw that out there. So I know I'm really excited. We're really excited to build this up and really start helping a lot of people. So just, again, reach out to us at any time. And we'll get you taken care of right away. Well,
I'm going to tell you how I describe you to my friends. You guys are godsend. Unbelievable. We're so glad we've had you. Mindful weight loss. And we'll let you know when Dr. Gupta will be on with us again for the California area. Thanks, guys.
Thank you, Steve. Talk to you soon. Thank you.
We'll see you next. And we'll be back next week with more Ask the Experts. Have a good week, and God bless everybody.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.